Welcome to WGU Prep YouTube channel. Access all practice questions. Healthcare policy and economics. Practice questions with answers. Question 1. Which of the following describes healthcare policy? A. Clinical procedures. B. Government regulations. C. Patient diagnosis. D. Nursing skills. Which one is the correct answer? The correct answer is B. Government regulations. Explanation. Healthcare policy refers to laws, regulations, and guidelines set by governments or organizations to influence healthcare delivery, access, and quality. Question 2. What is the primary goal of universal healthcare systems? A. Increase profits. B. Reduce staffing. C. Ensure access. D. Limit services. Which one is the correct answer? The correct answer is C. Ensure access. Explanation. Universal healthcare systems aim to ensure that all individuals have access to necessary healthcare services regardless of income or social status. Question 3. Which economic concept refers to limited healthcare resources? A. Supply-demand. B. Resource scarcity. C. Market failure. D. Cost-benefit. Which one is the correct answer? The correct answer is B. Resource scarcity. Explanation. Resource scarcity refers to the limited availability of healthcare resources such as staff, equipment, and funding relative to demand. Question 4. Which of the following is a government-funded healthcare program? A. Private insurance. B. Employer coverage. C. Public insurance. D. Out-of-pocket. Which one is the correct answer? The correct answer is C. Public insurance. Explanation. Public insurance programs are funded by the government to provide healthcare coverage to eligible populations. Question 5. What is the purpose of health insurance? A. Reduce costs. B. Increase risk. C. Share financial risk. D. Limit access. Which one is the correct answer? The correct answer is C. Share financial risk. Explanation. Health insurance spreads financial risk across a group, helping individuals manage the high costs of healthcare services. Question 6. Which term describes payment for healthcare services based on outcomes? A. Fee for service. B. Value-based care. C. Fixed payment. D. Capitation rate. Which one is the correct answer? The correct answer is B. Value-based care. Explanation. Value-based care focuses on paying providers based on patient outcomes and quality of care rather than volume of services. Question 7. What is a major factor influencing healthcare costs? A. Patient age. B. Technology advances. C. Staff uniforms. D. Building design. Which one is the correct answer? The correct answer is B. Technology advances. Explanation. Advancements in medical technology often increase healthcare costs due to expensive equipment, treatments, and procedures. Question 8. Which of the following is an example of healthcare inequality? A. Equal treatment. B. Same coverage. C. Unequal access. D. Balanced funding. Which one is the correct answer? The correct answer is C. Unequal access. Explanation. Healthcare inequality occurs when individuals or groups have unequal access to healthcare services due to factors like income, location, or social status. Question 9. Which policy aims to improve patient safety and quality care? A. Staffing ratios. B. Insurance premiums. C. Billing systems. D. Tax policies. Which one is the correct answer? The correct answer is A. Staffing ratios. Explanation. Staffing ratio policies ensure adequate numbers of healthcare workers, which improves patient safety and quality of care. Question 10. What does cost-effectiveness analysis evaluate in healthcare? A. Patient satisfaction. B. Staff performance. C. Financial profit. D. Outcome value. Which one is the correct answer? The correct answer is D. Outcome value. Explanation. Cost-effectiveness analysis compares the cost of interventions to their outcomes to determine the best value in healthcare decision-making. Thank you for watching. For more practice questions, subscribe to our website at WGUPracticeQuestions.com.